Welcome. We are going to talk about how diabetes increases your risk of urinary tract infections, the mechanisms behind it, the medications involved, and how to avoid these infections. Let's dive in and understand this important topic. Diabetes is a condition where your body struggles to manage blood sugar or glucose levels. This can lead to various complications, including a higher risk of urinary tract infections or UTIs. But why does this happen? First, high blood sugar levels can affect your immune system. When your blood sugar is high, your immune system doesn't work as well. This makes it harder for your body to fight off infections, including UTIs. High sugar levels in your urine can also create an environment where bacteria thrive, making infections more likely. Second, diabetes can cause nerve damage, known as diabetic neuropathy. This nerve damage can affect your bladder, making it harder to empty completely. When urine stays in your bladder too long, it gives bacteria more time to grow, leading to infections. Now, let's talk about some medications that people with diabetes take and how they might affect UTIs. One group of medications is called sodium glucose cotransporter 2 inhibitors or SGLT2 inhibitors. These medications help lower blood sugar by causing your kidneys to remove sugar from your urine. But this can increase the glucose in your urine, providing more food for bacteria and potentially leading to more UTIs. So, use other ways like reducing your carbohydrate intake and doing more exercise to make sure the amount of glucose leaving through urine is less. It's also important to know the symptoms of a UTI so you can catch it early. Symptoms include a frequent and strong urge to pee, pain or burning when you pee, cloudy or bloody urine, and pain in your lower abdomen or back. If you notice these symptoms, see your doctor right away. Early treatment can prevent the infection from spreading and causing more serious problems. For those already taking SGLT2 inhibitors, it's crucial to monitor for signs of UTIs and maintain good hygiene practices. Your doctor might adjust your medication if UTIs become a frequent issue. Diabetes affects the immune system's ability to fight urinary tract infections in several ways. Let's break down the key mechanisms involved. One significant factor is the presence of high blood glucose levels, also known as hyperglycemia. When blood glucose levels are high, it can impair the immune system's response. This impairment occurs because high glucose levels can reduce the effectiveness of various immune cells, such as neutrophils and macrophages, which are crucial for fighting infections. In people with diabetes, the immune system produces lower levels of an antimicrobial peptide called psoriasin. Psoriasin is part of the body's innate immune system and helps protect the urinary bladder's cell barrier from bacterial infections. Lower levels of psoriasin weaken this barrier, making it easier for bacteria to cause infections. This reduction in psoriasin levels is directly linked to high glucose concentrations, which decrease its production. Insulin, however, does not seem to affect psoriasin levels. Another aspect of diabetes that affects the immune system is the chronic inflammation associated with the condition. High blood glucose levels lead to an inflammatory response, which can damage pancreatic beta cells and further impair insulin production. This chronic inflammation also affects immune cell function, making it harder for the body to control the spread of pathogens. Diabetes can also cause nerve damage, known as diabetic neuropathy, which affects bladder function. This nerve damage can lead to incomplete bladder emptying, allowing urine to stay in the bladder longer. When urine remains in the bladder, it provides a breeding ground for bacteria, increasing the risk of UTIs. Moreover, diabetes can disrupt the natural barriers that protect against infections. For example, high glucose levels in the urine can promote bacterial growth, and the immune system's ability to produce reactive oxygen species, cytokines, and chemokines is compromised. These substances are essential for killing pathogens and coordinating the immune response. Diabetes affects the immune system's ability to fight UTIs through a combination of high blood glucose levels, reduced production of antimicrobial peptides like psoriasin, chronic inflammation, nerve damage leading to bladder dysfunction, and impaired natural barriers. These factors collectively weaken the body's defenses, making individuals with diabetes more susceptible to UTIs. But don't worry, there are 6 ways to manage this risk. Here are some tips to help you avoid UTIs if you have diabetes. However, there are some more ideas after the 6 tips. So, do not just leave after the 6th tip. Keep your blood sugar or glucose under control by reducing your carbohydrate intake. This is the most important step. By managing your blood glucose, you can help your immune system work better and reduce the amount of sugar in your urine. Stay hydrated. Drinking plenty of water helps flush out your urinary system, reducing the chances of bacteria growing. Practice good hygiene. Always wipe from front to back after using the bathroom to prevent bacteria from spreading. Wait, there is more, but do not forget to hit the like button if you have found this video useful. Thus YouTube will serve more videos to suit your interest on similar topics. Also, urinate after sexual activity to flush out any bacteria that may have entered your urinary tract. Wear cotton underwear. Cotton is breathable and helps keep the area dry, reducing the chances of bacterial growth. Don't hold in your urine. When you feel the need to go, find a bathroom and go. Holding in urine can give bacteria more time to grow. Avoid constipation. Constipation can cause bacteria to move from your rectum to your bladder. Eating a diet high in fiber, fruits, and vegetables can help keep things moving. Hyperglycemia, or high blood glucose levels, disrupts the immune response in diabetic patients in several key ways. Let's explore these mechanisms in simple terms. Firstly, hyperglycemia impairs the function of immune cells. High blood glucose levels can reduce the effectiveness of neutrophils and macrophages, which are crucial for fighting infections. These cells become less efficient at migrating to infection sites, engulfing pathogens, a process called phagocytosis, and producing substances that kill bacteria. This makes it harder for the body to control and eliminate infections. Hyperglycemia also affects the production and function of cytokines, which are chemical messengers that help coordinate the immune response. High blood glucose levels can lead to an imbalance in cytokine production, promoting excessive inflammation while also impairing the ability to fight infections effectively. This imbalance can result in a weaker immune response, making it easier for infections to take hold and spread. Another way hyperglycemia disrupts the immune system is by altering the function of the vascular system. High blood glucose levels can damage blood vessels, reducing their ability to dilate and increasing their permeability. This can hinder the delivery of immune cells to infection sites and impair the overall immune response. Moreover, hyperglycemia can lead to the formation of advanced glycation end products, AGEs, which are harmful compounds formed when proteins or fats combine with glucose in the bloodstream. AGEs can alter the structure and function of immune proteins, further weakening the immune system's ability to fight infections. Chronic high blood glucose levels also contribute to a state of low-grade inflammation. This ongoing inflammation can damage tissues and organs, including the pancreas, which produces insulin. The resulting damage can worsen insulin production and further increase blood glucose levels, creating a vicious cycle that exacerbates immune dysfunction. Hyperglycemia disrupts the immune response in diabetic patients by impairing the function of immune cells, altering cytokine production, damaging blood vessels, promoting the formation of harmful AGEs, and contributing to chronic inflammation. These factors collectively weaken the body's defenses, making individuals with diabetes more susceptible to infections. In summary, while diabetes does increase your risk of UTIs, there are many steps you can take to reduce this risk. By managing your blood glucose, staying hydrated, practicing good hygiene, and knowing the symptoms of a UTI, you can help protect yourself from these infections. Thanks for watching. If you found this video helpful, please like and subscribe for more health tips. And remember, always talk to your doctor about any concerns you have about your diabetes and urinary tract health. Do not forget to click the like button and subscribe. Up above you see a few videos related to some other herbs important for diabetes and health. Thanks very much for watching this video. Subscribe to my channel. See you in the next video.